We're very fortunate today to be joined by Dr. Mark Lesher. Since 1993, Dr. Lesher has been a corneal and refractive specialist with Eye Associates of New Mexico, the regional leader in comprehensive eye care, for over 35 years. Raised and educated in Albuquerque, Dr. Lesher received his medical degree from the University of New Mexico and is a fellowship-trained, board-certified eye surgeon. Dr. Lesher, thank you for joining us today to discuss vision correction options that are offered by Eye Associates of New Mexico, most specifically laser vision correction. Many people are familiar with the term LASIK, but what does the term actually mean?
Well, Darren, LASIK stands for the term laser in situ keratomileusis. And what that means is the reshaping of the cornea using something called an excimer laser. It's the most commonly performed refractive procedure in the United States.
How is a cornea reshaped?
There are several ways to accomplish this. The most common is the procedure that we call LASIK. With this procedure, what we do is create a flap on the surface of the cornea, which can be done one of several ways. The method that we use is called the intra-LASIK method, which creates a flap using a laser. Then the underlying surface beneath this flap is sculpted with a computer-programmed laser to change its optical power and correct someone's nearsightedness, farsightedness, or astigmatism.
Is this type of LASIK commonly referred to as BladeFree?
Yes, it's called BladeFree LASIK, or intra-LASIK is the other term that's used.
I see. Are there specific advantages to using a laser over a blade?
I would say the main advantages are the safety and accuracy of using the laser. We got good results using the microkeratome blade, but the results with the intralase laser are even more accurate and I think safer, which makes all of us feel better, both patients and doctors.
Absolutely. With this video animation, could you talk us through the LASIK procedure?
Certainly. What we're seeing here, Darren, is the cornea, the clear window on the front of the eye. This is what we'll be treating when we do the LASIK procedure. The first laser is called the intralase laser, and it creates a very precise pattern of little spots in the cornea. This laser has the unique ability to be focused at a very certain or precise depth within the cornea. And then each laser spot that is applied creates a little bubble that allows us to separate the layers of the cornea, creating the flap that we desire. Once all the laser spots have been applied, a side cut is created to create the actual flap. So now the flap has been completed, and we're ready to lift or reflect the flap. And this is done very simply with an instrument called a spatula, which lifts the flap and lays it out of the way. This exposes the central part of the cornea called the stroma. With the stroma exposed, we then apply the excimer laser, which has a computer-controlled treatment pattern based on each patient's prescription. The laser spots are applied generally over the course of 10 to approximately 30 or 40 seconds, depending on each person's prescription. The patient doesn't feel any discomfort during this procedure. Once all the laser spots have been applied, then we're ready to replace the flap where it belongs. This just takes a moment. The flap is replaced, and then the flap is smoothed into position, and it adheres without any sort of sutures. The whole process takes about 10 to 15 minutes for both eyes.
Dr. Lesher, thank you for the valuable information you provided to us today regarding LASIK. To schedule your free LASIK evaluation or for information on free financing, please visit the Eye Associates of New Mexico website at www.eyenm.com.